Thank you. And I want to thank the four presenters for their comments, insights, and recommendations. And would like to start to have the committee members start to focus their laser beam questions to our panelists. And just to comment briefly on Mr. Blackman's last comment about the overhead projector, it was voted the #1 educational intervention in the 20th century. However, we're in the 21st century now. Panelists, if again to follow Alan's lead, if you want to be recognized, please hold your name in a vertical position so that I can recognize you for that. And I'll take the prerogative of the chair to ask the first question. We've heard a lot about surveys and some prioritization and getting better information about populations. Many of us in healthcare are recognizing that accountable care organizations are emerging in the United States. Systems of care, hospitals, groups of physicians and healthcare providers are increasingly interested in the populations that they serve. The populations at risk, perhaps, of complications of diabetes, but also at risk for suicide. Is there a recommendation to the CDC that we should be thinking about that would start to begin to engage the healthcare sector, accountable care organizations, to better understand the risks of populations that they are now increasingly interested in getting engaged with? And I'd direct that to at least starting with Nina and Daniel and others of the panel.
As you know, there are groups interested in working on sort of healthcare response, particularly following a violent incident and interventions that could be mounted. There's not the science is not particularly well developed around it. There are some data. But I think the general idea, we know, and I think Greg alluded to this from the Milwaukee study, that retribution and revenge is clearly a common motive. And so that should be the first kind of thing that is on the mind of people taking care of those who are injured by violence. And of course, the people doing the care themselves probably have a limited ability to affect that, but perhaps they could ask some screening type of questions and make appropriate referrals, whether it's to law enforcement or to groups like ceasefire outreach workers.
And I would just add to that, I think there are opportunities when healthcare providers encounter patients who are facing mental health crises to develop and have the healthcare providers institute protocols around restricting access to lethal means and counseling patients and families when individuals may not rise to the level of being prohibited under existing law, but who otherwise are facing a temporary crisis and would benefit from being separated from lethal means, including firearms. And I know that we're going to hear from Dr. Matt Miller from Harvard later on, and I expect that he's going to talk about that. So I think there's another opportunity there to involve the healthcare community.
We've been very interested in this idea of the victim-offender overlap. That is, the victims are often offenders, and the offenders often become victims. So any opportunity, if you've got a victim in your care, to also think of them as a potential offender, I think there's an opportunity to disrupt future violence. And so, I mean, NIJ has, I don't know if it's still out, but we certainly have we've had solicitations looking at the victim-offender overlap, in addition to our current solicitations on firearm violence, which closes May 2nd, for those of you interested. And also look at police technology in schools is another one that's out there. But all of that sort of could come on, victim-offender overlap could come under any of those.
Great. Gary Kleck?
I have a question for Greg Ridgway. Compared to the breadth of topics that others covered, your social science agenda struck me as unusually narrow. And I was wondering if, in response to a report generated by this committee, whether NIJ would have any flexibility to broaden it a bit in connection with the kind of agenda we laid out.
So in fact, our current solicitation on firearms violence is open. We did not prescribe any particular areas that, that someone should choose. I picked this one as an interesting example, one, to showcase what we're currently doing on the topic, and also to give an example of the kinds of social science that seems to be having an impact in the field. But the actual solicitations that we're putting out are open to any best and brightest ideas that anyone has on firearms violence.
We love having to showcase Milwaukee. Being from Milwaukee, I ought to know, but Paul?
Speaking of Milwaukee, Dr. Ridgway, I was interested to hear greater details related to the use of the homicide death review. In some ways, not just for the information that's elicited through that review process, but also for the extent of community engagement and ownership of the issue. It seems almost akin to the infant death review process that's been long established in place in many states. Can you describe research that may have been done related to not just the information that's gained, but the extent of engagement and also the resource needs for sustainability of this kind of intervention? And in particular, your thoughts around generalizing that intervention to other circumstances, what size might be necessary, and so forth, just as an opportunity of an additional intervention.
Yeah. First, one thing that they did that was clever, I think, is they included the near misses also. The actual shootings were in there in addition to the homicides, because a shooting is just, an intended homicide that didn't quite go as planned, and so that's sort of that should be part of it. So that's one thing. Let me answer sustainability. We actually in East LA, we tried to replicate a strategic problem-solving exercise there, where we got police, DA, federal prosecutors, community members together to try to address that issue in Boyle Heights, where Stephanie was killed. And we made some errors in that process that affected sustainability. It became known as the RAND project, and people kept coming, and captains would turn over, but we would get that next captain in there as long as our team was there engaged. And as soon as sort of the grant funding dried up, the rotations, there was no one to sustain that, and what became known as the RAND project, well, the RAND project is now over, we can go back to our business as usual. In fact, when we analyze the crime, we see this drop when that committee was very engaged and sustained, and then as it dissipated, it went right back up to its level. So it does require a steady investment of time and effort.
Al Bloomstein?
There's a question for Paul Blackman. Judging from your comments, I gather that you feel hostile to the issue of doing gun tracing analysis. And it strikes me that that's one of the lots of people have talked about the problem of accessibility of information on the flow of crime guns into the hands of people who use those crime guns maliciously. And what's the rationale for limiting access to the kind of crime gun tracing information that's out there?
Well, my personal objection to it would have been that it's used for research that is supportive of the person who decides what guns are going to be traced. The problem we had with tracing was that BATF, now BATFE, so BAT, it's become BATFE, could influence policymaking essentially by deciding which guns to trace and which guns not to trace. Tracing is not something automatic. It's not something police do with every gun they come across. It's not something that tells you anything about gun trafficking or anything else in general. It's something that simply tells you which guns have been traced. It's useful as a law enforcement tool at some times, since you can figure out who owned a gun, perhaps, find a criminal that way, perhaps find a crooked dealer if you found the an ineligible person. But in terms of data, it produces data that are not useful for anything in terms of evaluation of where guns are coming from or going to. When the Bureau of Alcohol, Tobacco, and Firearms decided Virginia should come up with some sort of tougher restrictions, I think it was the 1 gun a month thing, they started carefully arranging guns to go to New York from a particular dealer, tracing them back to him. It dramatically increased the number of guns traced to Virginia. It was all done by them. When the so-called assault weapon issue became an issue, police departments were encouraged to trace guns that might be deemed assault weapons rather than ordinary or more ordinary firearms. So it looked as if they were being used, and at that point I think it was something like 20% of crimes, when in point of fact, if you looked at actual police seizures of guns, they were somewhere in the 1 to 3% category. So in terms of the tracing data, from our point of view, they've been primarily, from my point of view, they've been primarily misused in an effort to modify policy making in ways geared toward particular temporary schemes and not related to anything in terms of scientific research.
So if we could find some way to de-bias the tracing, the submission of guns to be traced, then you would be comfortable with that.
I might be. I don't know how you can do it, because the problem you would have then is that you would essentially have to try and get...
Down at the police department in what they submit, for example, for gun tracing.
Well, you would have to come up with a standard that somehow or other was relevant to crime control, but wasn't so overwhelming that BATFI couldn't possibly do it. Remember, it takes time and effort to trace a gun, so you have to be selective in some ways. So they'd have to come up with something that was selective. And the question is the something they're using that's selective, that presumably is geared toward law enforcement, going to somehow or other also be useful in research? And I don't know whether that's the case. And I don't know how you would define which guns you want police to trace, or for that matter, I don't know to what extent local law enforcement would cooperate. They have their own priorities, and keeping BATFI or researchers happy is rarely one of them. And one of the reasons why NIBRS is so much limited in which jurisdictions cooperate is because it asks for so much more jurisdiction. Most jurisdictions have better things to do than humoring the federal government or
Do you have a
researchers.
follow-up question, Al?
Yeah.
Hendricks Brown? I'm sorry.
Could I just ask one question of Greg Ridgway? In your looking at the ownership identification issue of guns, to what extent have you been able to look at costs, and can you provide some indication of the order of magnitude of that, of the cost of that user authentication?
Oh, the user authenticated guns.
Yes.
How much it costs?
How much it would cost to install a reasonable user
right now
authentication?
There is an accessory right now available for $400 to add on to a gun. That's on the market right now.
Is there a prospect that that might come down significantly?
Right. I mean, all of technology, follows the law that it's going to go down. So yes, it's going to continue to go down. And what's going to cause that? I mean, will market demand results? Is it some other sort of innovation? So NIJ is trying to position itself just to prompt those sorts of innovations that makes the technology available.
Hendricks Brown?
Thanks. I'd like to see if I could get Dr. Webster to continue discussion which I thought was intriguing about the use of models that have been used in alcohol for public health. And there's a whole range of those things. So my question is what are those kinds of areas, particularly, for example, interventions, the economic analysis of policies and other things that alcohol has been done, small scale, community-based randomized trials, has already been done in this field? What could be used and could be done? And then third is what might be different with alcohol and with gun violence?
So I want to make sure that I understand your question. So my point in sort of putting out the alcohol control as an example was not simply, while alcohol is an important risk factor, something that increases all violence, including gun violence, the idea that I was putting forward is, in essence, substitute guns in that sort of equation, just so I be clear.
Yes. Right.
So help me again specifically with the question.
Sure. So my question is the models that have been used to evaluate the research questions around alcohol that people have been doing for the last 20, 30 years or so, how much of those have already been applied to working in looking at gun violence? And then secondly, what could be done that hasn't been done yet? And then third is there something else out there that really distinguishes the gun violence research from alcohol that you think would be important for us to know?
Okay, just in terms of methodology and study design, it's hard to find any kind of randomized community trial out there. Sort of the closest thing that I can imagine to it that sort of touches upon gun violence is some interventions on directed patrols on hotspots for violence that has been done in Philadelphia. So conceivably one could, again, sort of apply the same type of study design. I think it's very difficult, though, because, excuse me, you probably need a little bigger area to work with and study if you're going to take a similar sort of environmental approach to thinking about guns and where they're coming from and how to reduce both the illegal transfer of guns as well as illegal possession and use of guns. So it may be that using those experimental approaches may be challenging for this type of approach with guns. Some of the interrupted time series analyses, just in terms of analytic tools, could potentially be useful applied to this problem. I will note something I mentioned in my talk, which is at least any sort of supply-oriented intervention will have to grapple with an admittedly difficult problem of sort of what assumptions do you make in that interrupted time series analysis of sort of how quickly those interventions affect gun violence. And probably the community trials are going to have a set of complementary things that ideally are both supply and demand focused. So you would want to try to reduce illegal gun possession, carrying in high-risk places and high-risk actors. At the same time, you're trying to address the supply side. So admittedly a challenging undertaking, but I think very well worth it, and many of the approaches used could be applied.
We'll take one last question from Jeffrey Runge.
So question to the panel, we've heard quite a bit about ideas about effectiveness research. Al asked a question a minute ago about the cost of technology changes. I haven't heard much in the first two panels about economic analyses of benefits. Irrespective of an earlier comment that you can't do a cost-benefit analysis on a constitutional right, which our Congress has repeatedly said, yes, you can, for purposes of public safety. What are your thoughts about the feasibility of doing reasonable estimates, economic estimates of the benefit side of the equation? Many technologies will be a cost burden to industry. Others will be a cost burden to the taxpayer. And really, to justify it, can really only be offset by benefits, including the externalities. Have you all given any thought to that?
I'll just start off. I agree with, I think, the underlying point you're making there, that potentially if we're going to have data and research that's going to inform policy, part of that policy equation is the cost component. And so I agree that, we were all forced to identify 3, and some used a bonus 4th. But clearly, I think most of us would probably agree that gathering the data on cost, and I would say in a broad way, aside from just sort of the cost of a product, but measuring the benefit side is very important, and Phil Cook is one person in this room who's done a lot of work on that that I think is very valuable. In some analyses that I've done in Baltimore, looking at both policing intervention as well as public health community interventions through the ceasefire replication, we've not gotten everything down in a way that probably an economist like Phil would do, but at least looking, for example, doing a comparative analysis of what does an added outreach worker violence interrupter add to reduction in violence in comparison to a detective that is on one of these focus units that's on the hot spots, where again you have some evidence, and we saw in Baltimore some beneficial effect. We saw almost interesting, very identical estimates of impact in reducing violence from a violence interrupter versus one of these detectives in the hot spots. But because their salaries and benefits are about half, it just seems as though we both are good investments, but maybe one even more so purely from an economic standpoint.
All right. There's been lots of estimates of cost of a homicide, and there's like 3 different methods: accounting, hedonic analysis, contingent valuation, that all put homicide at like $6 to $10 million each. You'll find, so the sort of the good thing is that these are really expensive, and even any sort of small reduction in homicide saves a lot.
I would note one other problem with measuring the cost benefit is trying to figure out, as I suggested, how people are going to react. For example, the suggestion that it costs $400 to personalize a gun. If you talk about mandating it, you're talking about that $400. The question then is, how much does it cost to essentially destroy the personalization for those owners who would like to have it that way, and how does that affect your estimate of any cost benefit? So you're not talking about just the 400, but whatever it might cost to undo or improve the personalization, as well as what you're going to achieve. And that's why I suggested one of the things you're going to have to figure out is how both the law-abiding gun owner and the non-law-abiding gun owner will adjust to various changes that might be imposed upon them as part of the costs and the benefit measure.
I've just been informed that we have added time for discussion, so we can continue. I apologize for suggesting that this was the last question. Lou?
Obviously, cities and states look to NIJ and the CDC for information in making policy decisions at the local and state level. You described the issue that a homicide is often that many people miss, but the intent was there, and so that they should examine the entire body of violence research and attempted violence research. Is it profitable, or would it be productive for the CDC or this study to recommend doing comparative analysis of the respective ordinances and laws? That America is just a patchwork of gun laws. And is there a way to do a comparative analysis that would be productive to the body of research, comparing pistol possession versus firearm possession versus felon possession, and looking at it from a macro perspective and seeing which jurisdictions are doing it right, whether other jurisdictions want to copy that, and how do we improve the body of knowledge about what legislation works at the local and state level.
Short answer is yes. I would leave it at that, but I think you're looking to me for a longer answer. Yeah, but also I think that we look for, like a lot of scientists, we look for a lot of natural experiments, real changes in the laws, or some wrinkle in the law that makes a prohibition apply to someone but not to someone else, but all other things are the same. And I think we're sort of relying on the creativity and innovation of our research community to identify those sorts of natural experiments so that they can see, here's an opportunity to test background checks, here's an opportunity to test ammunition regulations, and we are trying to build that cumulative base of knowledge about that through those sorts of natural experiments.
The only thing I would add to that is to say that I wouldn't suggest that the CDC invest in cataloging that patchwork of existing local and state gun laws. I think that work has been done and is being done by others, so I'm not sure that's a good use of CDC resources. But in terms of understanding how those laws are enforced by different jurisdictions, what the implications are for law enforcement facing different regulatory environments, and what the impact is of those various regulatory environments, I think by all means that's absolutely ripe for future research.
Gary Kleck.
A committee like this loves to hear some signs of consensus among people who otherwise might be tremendously conflicting on an issue like this. So I wanted to confirm whether I was hearing you correctly. This is directed at the panel as a whole. Did I hear you correctly that all of you think it's a priority to get a lot more information about the enforcement of gun control laws, which ones are actually being enforced and which ones are not? And secondly, that you all agree that we need some additional survey work done on gun ownership, and among other topics being how people would respond to changes in gun regulations, but also just basic information that updates what was learned from the National Survey of Private Ownership of Firearms a decade and more ago, such as the question of, what percent of guns are acquired through private transfers. Would everyone on the panel agree that those are two emphases that deserve further research attention?
I would. I am sensitive to the concerns that have been raised by other panelists about the difficulties of conducting the kind of survey that you're talking about, but in terms of the kind of data that could be produced from a large-scale survey like that, I think yes, that's absolutely an important area for future research, assuming you could work out those concerns. And as far as understanding how laws are enforced and what the different practices are in different jurisdictions for enforcement of existing laws, very much so, yes.
So on the first point relevant to gathering data and understanding better about how gun laws are enforced across places, I very strongly agree. One study I did that looked at state level gun sales regulations, we also were able to examine enforcement information, at least through surveys, from state and localities that license gun dealers, the degree to which they do any type of oversight practices for those dealerships. What we found in our study was that having the state licensing provision by itself had no relationship to diversion of guns to criminals. However, when you had that regulation and local and or state officials report routine inspection compliance, you did see a negative association with fewer guns. So I think that's incredibly important. I actually am not in agreement that a survey of the type that's been discussed about gun ownership and defensive gun use would be a wise investment towards helping us understand how to prevent gun violence. I think that while a lot of the data that are being referenced are very out of date, I also, it's been clear to me and some others, and Phil Cook alluded to this just with respect to the response rate, that there's huge challenges to getting valid data that have both internal and external validity. And I think that we would undertake the same kind of activities and come back with a lot of uncertainty about how valid those data are. And it's not obvious to me that that would lead to clear strategies to help us reduce gun violence.
Well, just to clarify my question, I didn't even mention defensive gun use. I was just saying there's a wide variety of topics that would have to do with gun ownership, and it's information you can only get by talking to people who own guns. And
Sure, yeah. So my comments pertain both to defensive gun use and even more generally gun ownership. It's, you know, if it were around, it would be good. It would add to the information, but under limited budgets, I think there's probably better investments. That's my own view.
I'm okay with them.
I'd say yes, generally, you're going to get more consensus on that than that any homicide costs $5 million.
Any other questions from the committee members? Logistics, Alan?
So, first of all, thank you, Steve. And we'll thank you again because you got to do the first session this afternoon. So it's 12:30. What say you we come back 1:15? Can we try for that? Okay, the speakers and the committee are invited to room 109 to pick up lunch. I apologize to everyone else. You are invited to go to the cafeteria on the third floor and find lunch and a cash register.
The members of the committee, once they pick up lunch, will go to room 110, and the speakers will stay in room 109. So the food is there to collect in 109, but the committee goes to 110 after it's picked up. Thank you.
Thank you, everybody.